Here we'll talk about fibrous dysplasia. So, coming on to the definition of fibrous dysplasia, it is a uncommon, non-hereditary developmental defect of bone characterized by of bone in osteoblastic differentiation and maturation. What we get to see in this is basically if there is any bone, it can affect any bone in the body. So what really happens is there is a normal bone, then this normal bone, it gets transformed into abnormal fibrous tissue. Then this fibrous tissue undergoes osseous metaplasia, which leads to the secondary bone formation. Okay, so another name of fibrous dysplasia is osteodystrophy, also osteitis fibrosa localista. Now coming on to the types. In types, there are three types. One is the monoostotic, the polyostotic, and the craniofacial. Now, in the monoostotic, it will affect one bone. Okay, single bone is affected, and it is very common. And a very characteristic feature is leontosis ossea. Okay. Now, in this, what happens is the person has a lion-like appearance. In polyostotic, multiple bones are affected, and there is two types. One is the Jaffe's type and one is the McCune-Albright syndrome. In Jaffe's type, what we see is there is polyostotic, that is, there is multiple bones that are affected, plus there are cafe olette spots. Now, what are these cafe olette spots? These are basically pigmented melanin areas which are present. They are also present in neurofibromatosis. Okay, now in McQueen Albright, there is same Jaffe's, everything that is present in Jaffe's type, plus there is endocrinal disturbances or endocrinal abnormalities. Okay, now coming on to the etiology. In craniofacial, all the skull bones will be affected. In etiology, it basically occurs because of the mutation in the gnas1 protein. Now, what is gnas1? It stands for the guanine nucleotide binding protein alpha binding activity, stimulating activity. Now, coming on to the gnas1. Now, what it does is it stimulates the G protein. Now, due to this G protein, there is an increase in the production of the CAMP. Now, the CAMP in turn, it activates or it stimulates the melanocytes or the melanoblasts. Now, these melanocytes, they release melanin, and due to this melanin, we get the cafe olette spots. Okay, now it also stimulates the osteoblast and the osteoclast. So we see the fibrous metaplasia converting into the secondary bone. Then there is also one more thing. It causes the dysfunction or the hyperfunction of endocrine glands. Now, if there is such a thing happening, the person gets precocious puberty. All right. Now, coming on to the precipitating factors. One of the precipitating factors is neurofibromatosis. Then glandular dysfunction, trauma, then infection, then abnormal osteoclastic maturation, also liver damage. Now let's discuss about the epidemiology of fibrous dysplasia. It usually occurs in the first and the second decade. It is more common in the it has no predilection. Now it is the location is important. It occurs in the skull, the facial bones, clavicle, pelvic, also mandible, maxilla. Now coming on to the clinical features. The very characteristic feature is painless or painless, yes, painless swelling plus bulging of jaws. This is the first clinical sign that is present of fibrous dysplasia. Then what you see is there first clinical sign. So what you see is usually it affects the labial and the buccal plates, but sometimes it also affects the lingual plates. And when it affects the lingual plates, what we see is it produces an excrescence of the border of the mandible. That is, it shows a bulging of jaw. Then there will be malalignment, tippling, displacement of teeth, also delayed eruption. Now, there is very important thing to remember. It is not a well circumscribed lesion. It is not a well circumscribed lesion. That is, it is seen to spread, and the areas that it spreads in, they are like zygomatic bones, maxillary sinus, floor of orbit, even back of skull. Okay, first of all, they cause malocclusion, then they cause the bulging of canine fossa, bulging of canine fossa, then they lead to the extreme prominence of zygomatic process. Now, you must remember two keywords here. One is hockey stick sign, and one is shepherd's crook deformity. Now, what is the hockey stick sign? What we see is there is the leg length discrepancy because of the involvement of the upper portion of the femur. Whereas in this, there is an increased curvature of the femur. So it appears to be like a crook. Okay. Then coming on to the radiographic features. In radiographic features, it will present as a radiolucent lesion. First of all, in the early lesion, it will be radiolucent, but in the later stage, what you will see is there will be radiolucency plus there will be radio opaque spicules. Also in this there is the presence of the rind sign, right? And it will give us a ground glass appearance, or it will give us the appearance of orange peel appearance, or even stippling, or even the appearance of fingerprints on thumb appearance. Okay. Now coming on to the histopathology. Now in histopathology, what we will see is there will be a Chinese letter pattern. God. So in this, what you will see is you will see cuneiform type. Basically, you will see C-shaped trabecule. It will be something like this. Either you can see empty lacunae. This is C-shaped trabecule. Absence of osteoblastic rimming, then multinucleated giant cells. Okay, so this is basically the histopathology. Now in differential diagnosis, we can write about Paget's disease, also about the giant cell tumor, and the low grade osteosarcoma. Now, coming on to the treatment. In treatment, just remember that if it is a large lesion, we will have to do the surgical contouring, and in small, we remove the defect. Also, we will see that we will have to do procedures for cosmetic. It does not have any specific treatment. So, for cosmetics, either orthodontic treatment as well, and cosmetic treatment. Also, if there is compression of the orbit, so we will do the decompression of orbital floor and so on. So this completes the fibrous dysplasia. I hope you understood. Thanks for watching.